Hey friends, thank you for tuning in to the Occlusal Table, where we bridge dentistry with business, culture, and current events. I'm your host, Taylor Jackson, and it's about 6 months since I've started my residency program, so I just wanted to reflect and share what I've learned as a new dentist. Let's get started. All right, let's jump into it. So, tip number one, don't be afraid of new spaces. So, just so you guys know, I only went to HBCUs for my educational background. I've went to Fisk University for my college degree, went to Meharry for my master's and my doctorate degree, and I was a little bit nervous. Going to coming here to UIC, which is a PWI, a predominantly white institution, and HBCUs are historically black colleges and universities. I was definitely nervous navigating in this new type of space. But that's why, like with being here in Chicago, that was something that was at the top of my priority list, is to look at the faculty members and making sure that they were diverse. I'm looking at the residents that were currently there and seeing that they were diverse. So yes, I did struggle with imposter syndrome for probably like the first month that I was here. And I feel like sometimes it never really goes away. But at least with me comparing myself to my other co-residents, I realized that we're all on the same level playing field. We all just graduated from dental school. We all have the same similar types of experiences and similar backgrounds. And with that, we all just came here to learn, and we want to do what's best for the kids. Even if you are the only minority in the room, know that your opinions mean something. Know that your words truly are valued. And you have to keep that with you, because if you don't speak up about how you feel or what you want to see changed, then nobody will know. So, being in these types of spaces, I don't feel as though I'm not heard. I don't feel as though I'm not seen. And that's what I'm very thankful for being here at UIC. It's okay to navigate in these new spaces. It's okay to be surrounded by different types of people. And that was something that I truly learned, that I don't have anything to be afraid of. Second tip is to be a sponge, because feedback is okay. I was very, very hard on myself coming into residency. When I was in month 2, I was like, why am I not getting this? Why are things not working? Why am I struggling with getting this crown to fit? Why am I struggling with my behavior management to, get my patient under control, with keeping their mouth closed, with screaming, with jumping all around the seats? Why am I struggling with this? I have to remember, I just started. I'm not going to jump into things and just be perfect. I know with us going into dentistry is a profession that attracts perfectionists. It attracts overachievers. And because of that, we tend to be the hardest on ourselves. And that was something I had to remember too. Feedback is okay. Taking those times to learn from the different faculty members, learning from those attendings, taking this person's behavior management style, taking even the assistants and their tips, their advice that they use to help manage our patients, taking some of their things and using that to manage my own type of clinical tactics when approaching my patients in the clinic. So it's okay to be a sponge. Learn from everybody, because I'm telling you, I have learned so much from the dental assistants that I definitely use that every single day when managing my patients. So definitely be open, learn from every single person, and take every moment not as criticism, but just as feedback so that you can become better as a clinician. Tip number 3, you're the doctor now. So with being the doctor, I definitely had to transition from saying, oh, I'm student Dr. Taylor, or I'm student Dr. Jackson, to I'm Dr. Jackson. And with that type of transition, it's not like like a high and mighty kind of thing. And, oh, I'm the doctor now. No, like, you're still there to learn. With being the doctor, though, It did come with a different type of weight and responsibility that I believe was owed to my parents. But with that, there is also a learning curve for me with working with assistants, with treatment planning, and making sure that I am clinically competent and discussing with my attendings my reasoning behind the treatment plan and why I wanted to go this route versus this route. And for my next tip, remember why you started. Because I'm telling you, there are some days when every single kid is a Frankel 1, which means in dental terms that they are definitely negative and their behavior is not good. There are some days when I have patients that are bouncing all around the walls. They are crying and screaming, even when I'm just doing a cleaning, and not wanting to open up their mouths. Sometimes I do have patients like that. Uh, but I have to remember why I started. I have to remember that I'm here to help the kids that some people do turn away because they are considered challenging or more difficult. And it's when I have those days that I had to even pull out my personal statement a couple times and read over that and say, okay, yes, this is why I started. This is why I want to go through this. Because days are hard. Literally, every single kid needs Barney energy at every single appointment, no matter how tired you are. Like every single kid. And with that, I didn't realize the exhaustion component that does come with working in pediatrics. But I have to remember every single day, I'm there to help these kids. I'm there to help these vulnerable populations that people deem challenging or deem difficult. And I want to do my best as their dentist, as their provider, as their doctor, to help move them towards a better oral hygiene and help them to not be scared of the dentist and have a better dental type of experience. But not saying that every single kid is difficult. Let me not say that because I do have some angels sprinkled in there. But we have to remember that in pediatrics or just being in a specialty in general, you're not going to always get those slam dunk cases. You are going to get those referrals of the kid with a mouthful of cavities. You are going to get those referrals with kids that are bouncing off the walls. And that's something that I didn't truly expect. I mean, I did kind of expect it, but it's not something that you can mentally prepare for or emotionally prepare for because there are kids that are going through some things and you are that one to identify it. You are a counselor in a sense. You're there to give them some of that encouragement, to ask them about how are things going on at home, how did things, how did these cavities get here? Even asking the parents and talking with them and getting that education component together as well. I think with being in a specialty, yes, it does take a certain type of person to have that kind of patience, to have that kind of compassion. But you also have to just remember, hey, you are built for this. Okay, times are hard, but remember you're built for this. You can do this. You have gotten through so much, and you are doing so much good out just by you being in that position as a resident. My next tip, stay connected with friends and family because you are more than a dentist. Okay, I'm more than being Dr. Jackson from 8 to 5, Monday through Friday. I'm more than that. There were times in dental school where I missed out on life events. I missed out on weddings, parties, birthdays, family reunions. I missed out on these things because of school, because I couldn't take off, because of different types of exams that were coming up. And yes, family and friends understood, but I still missed out. I don't, when they're reflecting on these types of memories, I wasn't there. I wasn't a part of those good times. And something that I'm making a priority with me being in residency now is to take that time off and say, hey, you know what? I'm using these vacation days and I'm going to spend that going to my nephew's birthday party, even though he just turned 3 and probably won't remember that I'm there. I'm using that time. And I'm going to take these days off to go to this wedding, even if I have to study for an exam. I'm going to use that time because life is short, okay? Life is short. You want to make sure that you're there for these moments, there for those pictures, and being able to engage in those good times. Picking up that phone and just giving them a call. That means literally the world to anybody. When you pick up that phone and just say, hey, I was thinking about you. You crossed my mind. So I'm definitely doing that more, especially since I moved further away from my family. With me being in Chicago versus me being in Nashville. In Nashville, I could have just got in my car, drove 4 hours to Atlanta, and spent time with my family. Now I have to buy a plane ticket because I am not getting in the car and driving 11 hours to go home just on a whim. So because I am further from my family physically, I don't want that to jeopardize my relationship with them at FaceTime, so that I can still pick up the phone, call my family, check in on them, and still feel closer to them now, even though my distance, my physical distance did change. But those are all the reflection points that I have for you guys in my first 6 months of pediatric dental residency. I'm sure I'm going to be doing another type of update as well. Just documenting my journey, showing the things that I've been learning along the way. And I really appreciate you guys' support, honestly, because this has been a lot, okay? This has been a long journey. Being in professional school is no joke. So definitely check in on your friends that are in professional school, that are on the professional journey, that are in residency, because it is not easy. It takes a lot of yourself. It takes a lot not only mentally, but emotionally, honestly. Because just to step into that range to do better for someone else than you would for yourself, it does take a lot. And sometimes we don't replenish ourselves. We don't engage in that self-care as often as we should. So please check in on your friends. Please talk with your friends, family, anyone that's going through this type of process, because it is a lot, y'all. It's a lot. It's a lot. But I'm thankful to be in this type of space. I'm thankful for the amount of people that I can help, the positivity that I can spread, and the impact that I can make. So if this episode has helped you in any type of way, just make sure you hit that subscribe button and that like button so that we can reach more viewers like you. But that's all we have for today. So until next time, remember to stay flossing and keep flossing. Bye, guys.